Hello, good morning, students. Good morning, students. Good morning, good morning. So, last class we discussed about bacterial diseases. Bacterial diseases more we'll discuss today. Uh, yes, initial two classes, as I said, yes, it was a little bit fast just due to more and more content. Means two chapters I need to summarize in short time period. For example, nervous system and endocrine system. And after that, yes, content is less and we can discuss more. So don't worry about that. Content, it was fast. You can repeat those videos, you can see, you can understand very easily. Means what I delivered there, easily you can understand in any time. Okay, then now we are going to discuss a few more bacterial diseases and then viral diseases. Bacterial diseases, if you have any doubt, you can ask. Yes, bacterial diseases. Anyone, if you have any doubt, you can ask. Yes, TB. TB is tuberculosis. It's a communicable disease. Yes, Sindhu, it's a communicable disease. What do you mean by communicable disease? All viral, all bacterial, all fungal, or pathogenic diseases are communicable diseases. Remember, all pathogenic diseases, all microbial diseases are communicable diseases. Okay, but mode of transfer from one person to another person, it will be different. For example, tuberculosis. Tuberculosis, it spreads from the person to person through droplet infection. What is droplet infection? Suppose, okay, I sneezed here. So in this sneezing, okay, small droplets, water droplets or sneeze droplets, it will be in air or on, suppose in front of me in one table is there. So on that it will spread. Any other person, second person, if he or she come in contact with that droplet on that table, then yes, going to be infected. So this is called droplet infection. Aerosol infection. DPT. DPT is diphtheria, pertussis, tetanus. Three diseases together vaccine. So for three diseases, single vaccine it is given together, combined vaccine. That's why it's called DPT vaccine. Diphtheria, pertussis, and tetanus. Pertussis is also known as whooping cough. Okay, sir, if I have malaria and my blood mix with anyone, uh, in other's body, will it spread? Yes. If you're suffering through malaria and suppose in your body, malaria I'll explain now also in detail. Malaria, it is not a bacterial disease, so it is not yet explained. It is a protozoal disease. Malaria only name I've given to you. Malaria I'll explain in detail, don't worry. So yes, if infected malaria patient blood, it is transfused to non-infected person, yes, that non-infected person is now also going to be infected. When offline classes will start? Soon. Chairman sir, he'll announce the dates about when it will start, when to come, when things it will operate. Parasitic diseases, yes, all these are parasitic diseases. What we are discussing, all these microbes are parasite in our body. They take food from our body, they take nutrition from our body, they host in our body. We are host, they are parasites. Okay, so all these are. If a snake bite was recovered after snake bite, after 1 to 2 months, yes, you can donate your blood. When is NEET exam? 4th of May. What is the difference between bacterial and viral disease? Big difference. Bacteria is bacteria and virus is virus. So in botany or in other classes, you may have studied what is bacteria, what is virus. Virus is connecting link between living and non-living. Viral infection is completely different, okay, and bacterial infection is completely different. Generally I'm saying bacterial diseases are curable. Yes, good question. Bacterial diseases are generally curable, not always, generally curable, maximum time curable. Viral diseases are close to incurable, or you can say maximum time incurable. Yes, incurable word I'm using here. Treatable, untreatable, non-treatable, it is different. Curable means complete eradication, complete removal of disease is not possible in maximum of the viral diseases. I'm not saying all, I'm saying maximum. But cure or elimination of disease, it is possible in maximum of the bacterial diseases. Very good. Dragon Basik, I'm from Bihar, or sir, you are from Bihar or UP. This is not your concern. I'm from Bihar or UP. I'm from India. Okay, and I'm your teacher. You need to learn the things from me. Okay, whether I'm from Bihar or the UP or Pakistan or Australia, it doesn't matter to you. Okay, so please, you can ask. Yes, my educational background, so that I can say I'm BSc B.Ed, MSc MPhil from BHU, Banaras Hindu University, and BSc B.Ed from RIE NCERT, RI Bhubaneswar NCERT. So this is my qualification. And yes, you can ask anything related to content. NEET how many marks? NEET how many marks? 720 marks. 720 total marks, total 90 plus 90 questions, 90 questions from biology, 90 questions from physics and chemistry. What is the causative agent of bacterial and viral diseases? Okay, very simple question, very simple answer. What is the causative agent of bacterial and viral diseases? Causative agent of bacterial diseases, bacteria. Causative agent of viruses, viruses. Your question is having to answer. In question only answer is there. Bacterial diseases, bacteria are causative agent. Different types of bacteria are there, we'll discuss, and different types of viruses are there. If I'm saying poliomyelitis, so poliomyelitis, the polio disease. Polio is due to poliomyelitis virus. Typhoid is due to Salmonella typhi bacteria. Will mosquito get sick by malaria? No. Sir, mosquito get sick by malaria? No. Yes, the difference between syndrome and disorder. Okay, first I'll explain the disorder. Disorder means what? It is not in order. So suppose your normal blood pressure is 80/120. Okay, 80 120 or 120 80, what you can say, it is your normal blood pressure. If normal blood pressure is not normal, it is even sometimes it is very high, sometimes very low, so it is abnormal to normal value, it is disorder. If you are normal with this abnormality, you are feeling no discomfort with this abnormal pressure, then it is disorder, not disease. Generally, disorders, yes, they are disease, but all disorders are not disease. For example, your normal body weight for this much height, suppose my height, normal body weight is 65 to 68 kg, 65 to 68 body weight in kgs. Suppose I am 85, suppose, and 85 also, all my physiological things, all blood pressure, my blood glucose, my blood cholesterol, everything is normal. Okay, all parameters are accurate, normal. Okay, and I'm not feeling any discomfort. My body weight is high. I'm not feeling any discomfort. No metabolic disorder, no genetic disorder. But yes, my body weight is high. It is disorder, but not disease. Snake bite, come or mouth. That is the different snake bite, different things. It is the symptoms it is seen. So that we'll discuss in main class. What it comes out from mouth, that is we'll discuss in main class. Not possible to discuss in online classes when we don't know species, type of snake giving of many antibodies can cause harm. Yes, it may cause harm, but you don't have any other option. So you need to go blind treatment or cocktail treatment. Yes, Janvi, what you want to ask? I can't relate it. Sir, do we need to remember all those what you have said yesterday? What I said the bacteria name, disease name. Yes, bacteria's name, and disease the how it spreads. That thing you need to remember. For example, what do you mean by plague? What is cholera? So cholera is due to Vibrio cholerae. It's a bacterial disease. That much you need to remember. It is a lymph node infection. It is a intestine infection. Like this, you need to remember. Generally, the horse, JK. Generally, horse is used, or you can say 99% time, horse it is used for anti venom production. Sometimes we use rabbit also. The rabbit generally used for laboratory lab based antibodies, not for human use antibodies. Unknown the snakes he got bit, so snake head and hand took to get anti venom. No. Dragon. You're not understanding the concept. Snake head in her hand and took it to hospital to get anti venom. Sometimes yes, doctors they asked which snake bite. So at that time, yes, we need to say it or to explain it to doctors. Then only they can provide accurate anti venom. Okay, species specific anti venom. So for that purpose, she may have carried that snake in hand to hospital. Okay, let's start today's topic. I think all your doubts, simple, small doubts done. Yes, in offline also I'll repeat. Don't worry, in detail we'll discuss this. Here we are discussing in shortcut, just shortcut. Okay, in offline also we'll discuss Harika. So everyone, please come here. We are discussing about bacterial diseases. Bacterial diseases. Now I'm going to discuss a few more points related to typhoid. Typhoid, last class we discussed Salmonella typhi. Typhoid, it is in detail in your syllabus. Typhoid disease is due to Salmonella typhi bacteria. This Salmonella typhi bacteria, it enters into your digestive tract or in human body through contaminated food and water. Contaminated food and water. It is also known as enteric fever. So first of all, why it is called enteric fever? Enteric means intestine. Enteric means intestine. So mainly it infects intestine. That's why I call enteric fever. One more point you need to mark here. Everyone, please. One more point you need to mark here. For typhoid, the test means the diagnostic test, what it is performed is known as Vidal test. So you need to mark it here. Diagnostic test. Vidal. And it is important for your question forming. Yes, in questions it will be asked. Okay, for typhoid, what is the diagnostic test? Or in a opposite way, question if it is formed, Vidal is used for which disease to confirm? Vidal is confirmatory test for what disease? Okay, so typhoid. Why the typhoid can occur? Very simple. Bhai, contaminated food, dirty food. Suppose any outside food if you are consuming, and in that food, suppose typhoid bacteria is there. So yes, it will enter into your body and it will cause the disease. Okay. So contaminated. Again, I'm repeating the contaminated food and water. Through contaminated food and water. Okay. So in slide, everything is mentioned. Due to slide, your portion, it is not going to be fast. It is going to be more effective if you are listening. More and more content you can learn here. Chalo. So through contaminated food and water. Now come to this. what happens? What symptoms patients they feel? Patients they feel headache. Patients they feel abdominal discomfort, abdominal pain, maybe mild pain, maybe moderate pain, maybe intense pain. Okay, then abdominal discomfort, fever, high grade fever, headache, headache the most important example, most important symptom for the typhoid. Then abdominal discomfort, fever, and diarrhea. Last class we discussed about diarrhea and dysentery. So who will explain diarrhea and dysentery? What is common in diarrhea? What is common in diarrhea and dysentery? What is difference in diarrhea and dysentery? Who will explain? Hello, Indian. Indian, he'll answer. Blood in motion. Very good. Very good. Very good. Great, great. So many correct answers. Okay, with wrong answers also. Chalo, but so many correct answers. I'm happy. So please, diarrhea and dysentery. Dysentery and diarrhea. Common is yes, there'll be the excessive water loss through fecal matter, through the motion, or you can say through the fecal discharge. There'll be large amount of water discharge, loose motion. In simple words, you can say loose motion. In dysentery, there'll be blood spots. There'll be clot of bloods, or there'll be small amount of blood coming out with fecal matter. So it is called dysentery. Dysentery is internal colonic serious infection or intense infection. Diarrhea is common in any individual, maybe due to upset stomach, maybe due to indigestion, maybe due to overeating, maybe due to any other problems also. So here you come. Okay, so discomfort, fever, and diarrhea. Okay, diarrhea. But in last class we discussed amoebic dysentery. Amoebic dysentery is due to protozoa, amoeba, intra-amoeba histolytica. Last class, if you can relate. Okay, and one more thing I want to say. If you people you want NCERT book, so best one app I'll suggest, NCERT book solutions. Okay, you can go to Play Store or Apple Store. There you'll get NCERT books and solution. You'll get all class 1 to class 12 NCERT books. Just you can check on Play Store. I'll show you that logo of that app. You can easily check it. You can check here. This is the app. Visible, I think. Sorry. NCERT books and solution. Red color logo. Yes, it will may not be clear. NCERT books and solution, red color logo app. You can access that and you'll get all the books at one app, all solutions, all from NCERT. Nice app. Okay, so please, intra-amoeba histolytica we discussed, we related with this diarrhea word. Chalo. Now you go to the pneumonia. Before going to pneumonia, one story mentioned in, or one small line mentioned in NCERT regarding typhoid. One cook, her name is Mary Mellon. Mary Mellon is also known as Typhoid Mary. Why she is known as Typhoid Mary? Anyone you know about Typhoid Mary or Mary Mellon? Everyone? Typhoid Mary? Yes, Mary Mellon, she was cook and she spreaded typhoid to many people during her cooking. Means suppose anyone infected, suppose I'm infected and I'm cooking for hundreds of people. And when I'm cooking for 100 of people, yes, my contaminated sputum, my contaminated saliva, yes, it went to food, it went to what I'm serving, and from me to many people. So Mary Mellon, nicknamed as Typhoid Mary, okay, and she was carrier. Remember, she was carrier for, carrier means not genetic disease carrier. Here, carrier means she is carrying the disease and spreading to others. Communicable disease, what you asked in initial part of class. So yes, she is carrier of. So Mary Mellon, yes, you can take the screenshot. Mary Mellon is carrier of. Mary Mellon is carrier of typhoid disease. Typhoid Mary. Okay, screenshot done. Now you go to pneumonia. Pneumonia means lung infection. Last class we discussed about pneumonia, that pneumonia, it is due to bacterial infection or maybe due to fungal infection, maybe due to viral infection. Okay, so here we are discussing bacterial disease, Streptococcus pneumoniae. Need to remember, site of infection, lungs. What happens to, okay, it comes to body through droplet infection. Okay, droplet, what is droplet infection? Beginning only I said, suppose I sneezed, so through my sneeze, small aerosol droplets, small droplets, it will be in air or any surface, and from that surface or from air, suppose anyone inhaled or anyone contaminated, okay, they are going to be infected with that same. Okay, what happens? Fever, cough, painful breathing. If in lungs mucus fill, if in person's body in lungs mucus fill, then there'll be a painful breathing. There'll be painful and brown sputum. Here one word came to sputum. Sputum means what? When anyone used to cough, during coughing, what mucus it comes out, it is called sputum. So there'll be brown color sputum. Okay, and this brown color sputum is due to mixing of blood droplets or blood part. It is mixed with sputum, so it is looking brown, not red. It is brown, maybe due to dead cells. Tuberculosis also we discussed last class. Everyone, tuberculosis, it is TB. In the beginning we discussed TB, shortcut. Okay, Mycobacterium tuberculosis, lung infection it is, but yes, tuberculosis, it can be of three types: lung tuberculosis, skin tuberculosis, and bone tuberculosis. Okay, very good. Then droplet infection, this is also droplet infection. Then what area of body and what symptoms to body it used to show? Thick mucopurulent nasal discharge. Same, nasal discharge, it will be thick, and here also there will be a prolonged cough for long days, cough, and it can be treated, it can be cured only with the help of the strong antibiotics and under medical treatment, not at home. Okay, with the help of antibiotics. Now next we are going to discuss about this is done, this is same it is repeating. Okay, now we are going to discuss viral diseases. What do you mean by viruses? So first I want to ask what do you mean by virus? With the meaning of virus, anyone? Anyone? Hello everyone, can you explain what is virus? Virus, no answer. No answer. Virus, no. Which doesn't have the fixed shape, no. Spreading, yes, one answer came. K-N Parimala, very correct. Okay, poison, yes, virus word means poison. Okay, so This word, it is opted for the organisms. Yes, I'm using the word organism. But viruses are not true organisms. Viruses are connecting link between living and non-living. Okay, so little you need to understand about viruses. Here I'll come. Little about the viruses. What is virus? You need to understand. Then only you'll understand viral diseases. Little. Okay, suppose I'm talking about one cell. So this is the one cell. Cell contains nucleus. Yes, in botany you studied the cell contains mitochondria, endoplasmic reticulum, Golgi bodies. Okay, then so many things: the mitochondria and cytoplasm. Okay, ribosomes, etc., etc. Okay, but in case of virus, if I'm talking about this is one virus. This is not benzene. This is the virus. Bacteriophage you may have studied. So virus, it contains protein coat and genetic material. I'm writing GM. That much, nothing else. Viruses they contain only and only protein coat, or called capsid, and genetic material. This genetic material is going to be either RNA or DNA. Either RNA or DNA, not RNA and DNA. Don't say RNA and DNA. RNA or DNA, either RNA present or DNA present. I think clear? No, here capsid is not cell wall. JK, here capsid is not cell wall. I'm not calling it cell. So how cell wall? Okay, capsid means here the protein covering. Capsid means here the protein coat. So it is called protein coat, protein capsid, any word you can use. But don't say cell wall. Cell wall means wrong. This is only you need to learn. This is only you need to rectify in class. Okay, so what to say, what not to say. Then only you are perfect. Okay, please. So here viruses, little introduction done. How viral infection it occurs. Bacterial infection, it is simple to understand, but viral infection, it will be tough to understand. So listen carefully. Very important, very interesting and important. You people are going to enjoy this term, this next, you can say 5-10 minutes if you are listening. So please, if I'll ask few questions related to viral infection, and if you'll participate, please help me. So if I'm asking that viruses, they are species specific. So what do you mean by this? Viruses are species specific. Everyone? Different species. Okay, no, not different species. I'm saying viruses are species specific. Viruses are species specific. And next line I'm saying viruses are cell or tissue specific. If these 2 points clear to you, yes, 50% of viral infection meaning it will be clear to you. So please answer. Viruses are, I'm saying they are species specific, they are cell or tissue specific. Reading your responses. यूनिक स्पीसीज, एक स्पीसीज के हिसाब से एक वायरस होता है. नो, particular species can only affect particular organism. Yes, correct. Particular species can infect, not affect, infect particular organism. Yes, one answer I got there. So means viruses. If I'm saying COVID, everyone please focus. COVID-19 I'm saying. So COVID-19 is one species, one species of, or one strain of virus. For viruses we don't use the term species. For viruses, we don't use the term species. Here, viruses are species specific. So this species is not for virus. This species is for the individual or the animal is going to be infected. Means suppose me, means suppose one dog, means suppose one cat. So viruses are species specific. One species only it is going to infect, not one individual. I'm saying one species. COVID-19, if it is infecting human, so yes, it is mainly specific to human only, not to other species, not to monkey, not to chimpanzee, not to cow, not to buffalo. If any virus infecting only and only cow, so yes, it is specific to cow. It will not infect to you. Cow viruses are generally different. Human viruses are different. You got the meaning? Yes, very good, very nice answer. Nagarju Akula, some viruses have very strict host. Yes, this is the answer. Some viruses they have, not some, maximum viruses, they have very strict host. So generally one virus, it infects one particular species only, generally. So it is called the species specific. Then again, I'm saying the cell or tissue specific. Okay, examples I'll give. Don't worry. If you'll answer, you will get the meaning. Please, first you answer this one, then we'll jump to the types of viral diseases. Sir, how many viruses are generated? This is unnecessary, means not related to our topic. How many viruses are there? Okay, unknown. Because viruses are least studied group of organisms. We can't study all viruses at present time because they are submicroscopic structure. Submicroscopic means with the help of microscope also you can't see. Electron microscope you can see, and that also not very clear. Yes, certain particular organ. Yes, very good. Neetu, the correct answer. As I said, viruses they infect particular species. Yes, viruses they infect particular cell or particular tissue only in your body. For example, again, COVID. COVID used to infect your palm. COVID used to infect your skin. COVID used to infect your stomach. Yes, no. Yes, correct answer. No, 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 no. Correct answer means yes, viruses they used to infect particular tissue in body. For example, COVID viruses, COVID or all the rhinoviruses, they infect only nasal epithelium and respiratory tract. Nasal epithelium and respiratory tract. So they are species specific and tissue specific, not whole pulmonary area, not pulmonary disease, not whole pulmonary area, but one particular epithelium. For example, I'm taking HIV, human immunodeficiency virus. HIV infects only and only HIV infects mainly and mainly the T helper cell and macrophages. So I'll come to this viruses, they are species specific, and if I'll write infects particular species only, and for this cell or tissue specific means infects particular tissue or cell only. I think these 2 points clear. COVID-19 used to infect human. For example, the HIV, human immunodeficiency virus, it infects the T helper cell. T helper cell plus macrophages only. Clear, everyone? Not copper T cell, T cell. Copper T cell name ta? T cell, T cell. T helper cell. Everyone clear? So this is your immune cell. T helper cell is your immune cell. Macrophages are your immune cell. Okay, I think these 2 points done. Viruses are cell specific, viruses are species specific. Now, come to the virus disease list. First virus and disease, measles virus. Measles virus, it is also called rubella. RNA virus it is RNA virus, means its genetic material is RNA. Okay, polynosa virus, just you remember polynosa virus. Okay, then it spreads through droplet infection, respiratory tract infection, that much. Okay, here you can, not required, only this ones. Mainly name, measles is a viral infection, that much, full stop. Measles is a viral infection. In exam it will come, measles is a viral infection or bacterial infection, viral infection. Okay, what is macrophages? You can note it down. Macrophages are the types of white blood cells. Okay, scavenger cells. In class 10th you may have studied the macrophages are WBC types, WBC cells, immune cells. Chalo, next, mumps, very important. Mumps disease, it is due to the paramyxovirus. Mumps are, it is also RNA virus. This one is also RNA virus through droplet infection, very important. Mumps is parotid salivary gland infection, parotid. So you are having 3 pairs of salivary gland, parotid, sublingual, submaxillary. So 3 pairs of salivary glands we are having, parotid, sublingual below tongue, and the submaxillary salivary gland. So 2 here, 2 here, and 2 here. Here is one salivary gland called parotid salivary gland. Parotid salivary gland is infected. You may have heard about that people, they can't speak for 1 week, okay, and they're having the swollen this, okay, neck, this cheek region just below ear area, here swollen. This is mumps. This disease is mumps. Everyone, please focus here. Mumps is what? Parotid salivary gland infection. Parotid salivary gland infection. I think now it is easy to understand. Slow, clear, not fast. Some viruses, they affect human and other animals also. Yes, they affect. Yes, you are correct, but they are also specific, not random. I said the specific. Specific means this specificity may be to one group also. Okay, but it is not that they infect to all animals. They infect to particular group of animals, particular species, particular one species. I'm not saying particular group of species, particular one species. Very nice, faculty. Thank you. For aspirants who are going for NEET exam Sunday. Thank you, Rajesh. Rajsekhar Ravipati sir, thank you sir. Yes, I'll convey your message to all the students. Thank you sir. There was a news that COVID was affected to lions too. No, fake news, fake information. So yes, Chepandi, is it going slow? Okay, okay, students. Okay. Chalo. So mumps, everyone clear. Paramyxovirus clear. RNA virus through droplet infection, very easy. High fever, nothing to understand. Headache, nothing to understand. Swelling parotid gland. Swollen parotid gland. Here is parotid gland, just below your ear capsule. Ear, and this line is parotid gland. Here, can you understand? Parotid clear. Okay, MMR vaccine, measles, mumps, rubella. Measles, mumps. So mumps, measles, rubella. MMR. So what vaccine it is provided to patients? MMR vaccine. Okay, all of you, or I can say maximum of you have got the MMR vaccine during your childhood. In hospital only, maximum of you, all of you, us, we can say we are vaccinated with MMR vaccine during our childhood only. MMR full form. If you want to remember, if you want to, I'm not giving you more pressure. Yes, memorize this. But if you'll memorize, yes, you'll be expert. But if you're not memorizing, don't worry, it will not come in it exam. It will not come in, just for your GK. Okay, small kids also, they know this name. Measles, mumps, rubella. Measles, mumps, rubella. Measles, mumps, rubella. Remember this. Everyone clear? Very good, very good. Next you go to poliomyelitis. Poliomyelitis last class also we discussed. Very good. Now go to poliovirus. Virus name poliovirus. Okay, nasal secretion and urine and feces infection. So how it spreads from person to person? How it spreads from person to person? Through nasal discharge, through urine or through feces. Okay, remember it is the GIT infection. Okay, it is polio is a GIT, gastrointestinal tract, or orophycal route infection. Orophycal route, oral and fecal route infection. So yes, urine, feces and nasal discharge, all it is coming from the what? Oral or fecal discharge. So what it will happen to symptoms? Fever, headache, sore throat, twitching in and convulsions. Exactly, it affects this virus. It affects mainly of the muscles, and muscle decay starts with time. So it is what it is mainly infection to several body parts, several areas of body. Okay, and twitching and convulsions it starts. Leave it. What is vaccine? To oral polio vaccine. Maximum vaccines are injectable vaccine. Vaccines are the injectable maximum. In the form of injection it used to come down. But oral and few more vaccines are oral vaccines. Here, sorry, polio. Polio is the, and few other vaccines are oral vaccines. Oral polio drops you may have taken. So it is what? Oral polio vaccine. In polio, okay, injectable vaccines are also there. In polio, injection based vaccines are also there, that we'll discuss in main class. So come here. Chickenpox. Chickenpox, maybe you have heard about the chickenpox. Polio done. Okay, chickenpox. Chickenpox, the zoster varicella. I'll suggest not to remember, just remember chickenpox virus. Okay, through contaminated article and with patient's contamination, means body to body contamination. Very simple infection, very easy infection. Just body to body contact, and yes, the chances are there you'll be infected if next person is infected through contaminated article and patient, direct physical contact. Okay, pinkish rashes on body. On skin, you'll get the round pink color rashes, and these pink color rashes are the blisters due to infection. Blisters or wound, or you can say pimple-like structures due to viral infection. Okay. So here pinkish rash on body, varicella vaccine. No need to remember at this level. So at this level, mainly disease name you need to remember. Mainly disease name, under what category it comes. Means suppose I'm asking the viral diseases, these four names must be on your tongue. Viral diseases, measles, mumps, it is the measles, mumps, polio, chickenpox. Measles, mumps, polio, chickenpox. Now go to, you can take the screenshot everyone. Bacha, you can take the screenshot. One good question. How long is someone contagious? Okay, till virus, the time period till it is cycling in body it will be contagious. For example, for chickenpox, it is generally 7 to 8 days. When he or she is infected, one person is infected, next 7 to 8 days that person is contagious, infectious. After that, body itself used to destroy that virus. But yes, remember, for virus there is no medicine. For virus there is no antiviral drug. Antiviral treatments are there, but antiviral complete killing drugs are not there. There is no drug. Remember this line. There is no drug to kill virus. Yes, there is drug to inhibit virus, but there is no drug to kill virus. You can write this line in your notebook. No drug to kill virus. No antiviral drug to kill virus. Yes, very good. Different between vaccine and antibody. Yes, vaccines are pathogens itself. When we take vaccine, we are taking exactly the pathogen only. We are taking the same virus only. Suppose I'm talking about MMR vaccine. So we take this exactly same viruses in our body, but not live virus. We take dead virus. And when we take dead virus, our body forms memory for that. Our body forms immunological memory. And this immunological memory, our body use it for the secondary infection. When real infection we get, after some time, at that time our body used to show strong response to that and used to fight to that. And your body used to form the antibodies against that, and that is called your active immune response. And that it will be taught by Siddhartha sir. Siddhartha sir in next session means after I'll complete this all. Okay, sir, he'll explain immunity in detail or in shortcut. And when you'll come here, we'll discuss detail how antibody and antigen antibody it used to interact, and how vaccines they work. So in main class I'll explain that. So sorry for that. You come here, we'll discuss in detail how vaccine and antibodies are different. Vaccine, it comes under active immunity. Vaccine, it comes under active immunity, and antibodies, they come under the passive immunity. Antibodies, if we are taking from outside, ready-made antibodies, if you are taking, it is called passive immunity. So I think little I explained about that, more detail in offline classes. So all it done. Now go to more viral diseases. More viral diseases here. Influenza. Influenza means nothing but the common cold. Common cold every 1 month, every 1.5 months, when you are suffering through cold, okay, sneezing. It is nothing but the flu. We call it flu. It is influenza. Disease is influenza. Common cold also it is called. Influenza disease, common cold, flu. It is due to which virus? Orthomyxovirus. Orthomyxovirus, no need to remember, not very important. How it spreads? Yes, we know, through droplet infection, through droplet, sneezing, coughing, and yes, one person to next person. I think clear. Then discharge from nose, sneezing, headache, fever, etc., etc. Not very tough to understand. Influenza vaccine for this. Okay, then here you need one correction. Second disease here in this list, Dengue fever is due to falcivirus. This falcivirus only causes, remember, this falcivirus only causes Japanese encephalitis. This falcivirus only causes Japanese encephalitis. What is encephalitis? I'll mention here. Encephalon. Encephalitis here. Encephalon means brain. Encephalitis. Encephalon means brain. Everyone. Encephalon means brain, and brain infection due to same virus. Brain infection due to same virus is called encephalitis. It is also called Japanese encephalitis. It spreads due to Toga virus or falcivirus. Okay, and it spreads from person to person through Aedes aegypti mosquito. Which mosquito? Aedes mosquito. Bite of Aedes mosquito. So Aedes mosquito hepatitis is spreading agent. It used to spread these diseases from one person to next person, one body to next body. Carrier, you can say. So Aedes mosquito is carrier. People, they suffer through high grade fever. Yes, here symptoms important. In some of the slides, in some of the diseases, I said symptoms not important. Okay, this area not important. So when I'm saying it is important, yes, important, mark it. High grade fever, severe pain in joints, okay, rashes on chest and body and upper limb. Upper limb is hand. Why it is rashes? Due to low platelet count. In dengue disease, platelet count decreases. Platelet, I think you know. Platelets arrow down. I'm writing platelets arrow down. Platelets decreases. What is platelets? In your blood, 3 types of cells are there: RBC, WBC, platelets. So platelets are also called thrombocytes. And when platelets they decrease, it is symptom of dengue, and it is due to falcivirus. It is an infectious disease. Okay, the time period when the virus it is in your body, your platelet count will decrease. To support, to increase your platelet count, doctors they give different types of treatment. Have you heard about this disease? Have you heard about what type of treatment, what type of food doctors they suggest to increase platelet count? Anyone? Anyone, can you explain? Can you say? Answer? Yes, very good. Papaya? Iron rich food, no fruit. Mainly the papaya, pitaya. Pitaya means dragon fruit, and kiwi and goat milk. Goat milk, papaya. Papaya in large. Papaya is the rich food to, you can say, it will increase your platelet count. Then kiwi, yes. And pitaya. Pitaya is also called the dragon fruit. Dragon fruit, you know, pitaya, dragon fruit. Okay, so remember this. So increase platelet count. Dengue disease done, falcivirus, bite of Aedes aegypti, Aedes mosquito. Remember, Aedes mosquito. It spreads same, everyone, same mosquito, it infects arbovirus. Arbovirus, okay, same mosquito. Can you see Aedes aegypti? And disease name is yellow fever. One more disease is there, chikungunya. Chikungunya is also due to same mosquito. Mosquito it will be same, virus it will be different. Virus it will be different. Okay, mosquito same, Aedes aegypti. Chalo, again back to this. Here I'm writing here incident joint pain, pain in joint. So those who are suffering through dengue disease, they suffer extreme pain in their joints. That's why it is called break bone fever. People they suffer through severe pain in their joints. Okay, they feel that yes, their bone it is breaking. That's why called break bone fever. Break bone fever. Rabies. Rabies you may have heard about due to dog bite, but not exactly due to dog bite. Any carnivore animal, okay, or any animal, any wild animal, you got bite, and suppose that animal is infected with rabies virus. If animal is infected with rabies virus, you are also going to be infected with rabies. In rabies patient, hydrophobia it is seen, means those who are infected with rabies virus, they feel fear to water. They can't drink water. When they drink water, they feel extreme pain in their neck region, and this condition is called hydrophobia. Okay, and exactly it destroys several centers of brain. Remember, this virus, it destroys several areas of brain, and slowly death. It is incurable, completely incurable. Remember, this disease can't be cured. But if you got dog bite, cat bite, or any wild animal bite, okay, go fast to the doctors. They'll give vaccine, they'll give anti-serum, means it will destroy viruses before infection. It will destroy viruses before infection, so that you can cure in, means just before infection you can eradicate it. Means you can't cure, but yes, you can treat it before infection. Through saliva. Saliva of what? Saliva of infected animal. Saliva of infected animal. Then destroys brain area, spinal cord, and fear of water. Anti-rabies vaccines. Yellow fever, arbovirus, yellow fever. Then smallpox. Last slide you discuss about the chickenpox. Here smallpox. Rabies important. Yellow fever you can discuss here. Smallpox. Variola virus. Variola virus. Viruses here not very important, not very important. This is important, this is important. Bite of Aedes aegypti we discuss. Droplet infection not very important. Yellow fever not important, not important. Okay, so here you can take the screenshot. Students, you take the screenshot. Done. Okay, then one question is there, sir, what is used for making vaccines? What is used for making vaccines? For making vaccines, pathogens are only used. You remember this stuff? For making vaccines, pathogens are only used. If I'm making, suppose, COVID vaccine, yes, COVID viruses are only injected, but not in live form, dead viruses. When dead viruses are in your body, it will form memory for that. And when real viruses it will come, when live virus it will come to your body, it will fight strongly with that, and it will show secondary immune response. This secondary immune response will be very strong, and you're not going to suffer with that disease. You'll be safe. Your body, it will be safe. I think it is clear to you, everyone. All clear? Any more doubt? Remaining things next class. Next class we are going to discuss the protozoal two diseases, and then cancer and AIDS. 2 more classes I think left. So protozoal diseases, malaria and all these next class, and then cancer and AIDS. These are the viruses you can see here, different types of viruses. Okay, but almost all viruses, they are the sub microscopic, means with simple microscope, with advanced microscopes also we can't see them very clearly. They are sub microscopic, not through simple or even advanced microscopes we can see them. So these are viruses, and these are not real photographs, these are computer generated graphics. Okay, these are computer generated. This is COVID one, COVID viruses you studied. COVID, you gone through the time period, and in TV channels this image you may have seen COVID. Okay, chalo, tata, bye bye, have a nice day, and remaining your doubts next class we'll discuss. Black fungus also will discuss, no problem. Okay, yes, Kavya, next class black fungus also will discuss, don't worry, just remind me in the chats, we'll discuss black fungus also.